Hi, my name is Liane Jollon. I'm the Director of San Juan Basin Public Health here in Southwest Colorado, serving Archuleta and La Plata counties with our weekly COVID update for January 22nd, 2021. It's been a little over a month since we received our first shipment of vaccines in Southwest Colorado. Since then, we've vaccinated thousands of our community members, and these are the community members who are most at risk. As of January 21st, this includes 1,889 vaccines administered in Archuleta County. 1,380 of these vaccines went to individuals who are over 65, and this translates to 36% of the over 65 population in Archuleta County having received their first dose. In La Plata County, this is 4,717 vaccines administered across the county so far. 1,647 of these were administered to individuals over the age of 65, and this translates to 16% of the 65 and older population having started their vaccinations. So what does this mean big picture? According to the state's direction, Colorado is currently vaccinating the phase 1A high-risk healthcare workers and the first half of phase 1B. San Juan Basin Public Health continues to provide vaccines to our high-risk and moderate-risk healthcare workers, long-term care facilities, and first responders for the first half of 1B. 1B also includes all Coloradans over the age of 70. So according to the state plan, all other providers, such as hospitals, healthcare systems, pharmacies, and safety net clinics, are to focus on vaccinating all of the people in Colorado over the age of 70. At this time, 50% of the 1B vaccine is distributed to hospital systems across Colorado for this group. San Juan Basin Public Health is also working within this plan to try to order doses for clinics not currently included in the state plan, like the community clinics that you may have heard about around La Plata and Archuleta counties. So with all of these providers working across Southwest Colorado and working across the state, Colorado is expecting and planning to get through this top half of 1B by the end of February. Once that's complete, the state plans to move into the second half of 1B, which includes lots of frontline essential workers, and especially teachers and childcare workers, so that we can get our kids safely back in school and get the economy back on track. I encourage residents to go to our website and sign up for vaccine notifications on an online form. We want everyone to really understand that this form does not make an appointment for you. What this form does is it collects your information, helps you identify what phase you're in, and then you'll get an update at least weekly from us with information about what kind of doses are available in our community, what providers have them, and where you can go if your phase is being vaccinated, and how to get an appointment with that provider. The other thing that's important to note is that this is not the only way that vaccine information will be distributed across the community. You might also hear from a primary care provider that you've seen in the past, from a clinic, or a pharmacy that has your information, inviting you to make an appointment when your phase is open. So again, there's lots of different providers, lots of different systems being built, and all of this is to move Colorado through these phases and get everyone vaccinated as quickly as possible, depending on how much vaccine is available. As a local public health, we are really grateful for the partners who are helping us get vaccine out to this community. We're also really grateful for each and every one of you and the patience and understanding that you all have, that this vaccine plan is still being figured out in the state of Colorado and across the country. I think we're all looking forward to more vaccine availability, and we're looking forward to how we will negotiate this pandemic in coming months. But we also have to remember that right now, vaccine is not the tool that's going to control this pandemic. We still have to follow all of our precautions while this vaccine network is being built and vaccine is distributed across the state and across the country. We also have to recognize that the way that the states are phasing and distributing vaccine right now could be subject to change, and the supply chain could be subject to change. So with that, please remember to continue to use your face mask. Please remember social distancing, maintaining that distance of 6 feet is still really important. Limiting indoor activities where we mix households is still an important part of controlling this pandemic. If you're symptomatic, please don't go to work, and please do get tested so that we can give you direction on isolation. And if you are notified that you've been exposed, we still have to quarantine for COVID-19. We all have a responsibility as a community to protect those around us who are at highest risk. This includes individuals who are older, individuals with comorbidities, and it also includes individuals who are working in high risk, high public contact, essential work right now that are not yet eligible for a vaccine. So please continue to do your part. Think about in your workplace how you can improve ventilation. Let's all remember how many times a day to wash our hands. Let's protect each other. And finally, when your phase is available for a vaccine, please sign up for the vaccine. That's how you will also do your part. Remember that the biggest limiting factor right now in vaccines is still supply. There is not enough vaccine being shipped to every state. There is not enough vaccine within the state to ship to every county. We believe that this supply chain is going to be fixed and more vaccine will be available, and our state and our country will start moving through this more quickly. But right now, we're asking you, hang tight, follow the precautions, and let's all continue to get through this together. Thank you.